us. Thank you.
Thank you so much, Chris. Thank you. Well, good afternoon, everyone. We are excited to be with you to have a conversation about all that's going on in the U.S. I'm pretty confident there's lots to talk about. Thank you, GTNF, let me say, for bringing us together. It is always a great conversation, and I know that the next couple of days are going to be full of great dialogue. It is an honor for me to be sitting here with these ladies who really each bring a unique perspective about what's going on, and I think Chris gave all of us a nice intro. I wasn't going to read bios, you have them, but please do take a look. These are well-credentialed women who know their stuff. Our task, though, is to provide some context for all of us about what's going on, and as Chris said, we have a new administration, right? We knew that when we came into this year, it was going to be something different, and that change was coming. What we didn't know is what shape that change would take, and we're starting to see glimpses of what that means and what that looks like. Change was needed, so if I provide just a little sort of snapshot or postage stamp of what we see in the US. We have a marketplace kind of run amok. We have dysfunctional product pathways, and a regulatory system falling far short of what was intended when it was established. So we're going to attempt to answer for this conversation today, what's going on? What do we expect to be happening? And how might we get the US regulatory system operating in a way that is more consistent with its intent? So we're going to start, I think, with hearing just some initial perspective from folks so we all kind of understand the angle that they're coming from. We'll have a good dialogue, but we totally welcome interaction with all of you. So if there's stuff on your mind, for those of you who don't spend a lot of time thinking about the US, feel free to ask us our perspective. And those of you that kind of are in the muck with us, we welcome your perspective as well. So, Laura Lee, take it away.
Thank you, Paige. Good morning, or afternoon, I guess, as it were. Jet lag is still very much with me. So I am Vice President of Regulatory Affairs at Hype Group, which in the United States means northernerandnicokick.com. We ship to the zip code level. And so what I thought I would do today is just give you a little bit of a state overview. I think sometimes it's hard to remember that the US is not just one big monolith, that there are 50 different states, and those states have the power to regulate tobacco in addition to what the federal government does. Also, a big thank you to Alex Wick from PMI, who built the beautiful slides that you're about to see. Okay. Maybe. Let's try this one. All right, so just as a quick overview, the Family Smoking Prevention and Tobacco Control Act gave the FDA authority over product standards, pre-market review, manufacturing standards, which we are still waiting for, and labeling and warning. That leaves to the states then the additional power to regulate sales and distribution, advertising and promotion, and taxes. And I will say that this is not as clean as any of us want it to be, and I would offer you menthol as a pretty good example of this. Arguably, menthol is an ingredient, and therefore any attempts to regulate it should be treated as a product standard. This is certainly an argument that the industry has made in court and hasn't always won. So even with something like a product standard, it's been ruled to be a marketing issue instead, and that has given the states the power to pass flavor bans in that light. So it's not clean. It can be difficult to track. This is still not working for me. No? Oh, there we go. Okay, so taxes. We started the year with around 14 states that had a tax on nicotine pouches specifically. This was in January. As it sits today, sorry, can you make it work? There we go. All right, so we have another 6 that got added to the roster just between January and October. My prediction is that for 2026, we're going to see even more taxes get passed on this category specifically. That is being driven, at least in part, by changes at the federal level with regard to Medicare and Medicaid policy. So states that have expanded those programs are going to have massive budget deficits, and typically the first place that these states are going to go to find that revenue is going to be these classes of products, but nicotine pouches more specifically because they just haven't done it yet. So we're going to see more taxes. And, sorry guys.
Flavor ban, that's your next one, right? Isn't that your next one?
Yeah. The dark purple is what we had today. The light purple is what we think is coming. So bills get pre-filed pretty early, or politicians indicate that they're going to take this step. So we can confidently forecast that the 2 states that have flavor bans today will more likely become more like 10 or 12 by the time we're through with the state legislative cycle next year. And this is despite the fact that the evidence continues to build around the idea that flavors are not just important, but maybe even necessary to help smokers transition to these lower risk products. Damn it. Registry bills are another one that we're watching pretty closely. Most of the registry bills are focused on e-cigarettes and really an attempt to sort of get at the illicit market of disposables that exists today. Sometimes pouches get included in those as well. Once you get a bill in front of lawmakers, it can take on a life of its own, and they'll do what they're going to do with it. So several states have registry bills. It looks like we're expecting damn near all the states are going to have a registry bill by the time we get through with next year's legislative cycle. This is great. That's it. Thank you.
Well, following on that, I'm Beth Oliva. I'm a partner at the law firm of Fox Rothschild. I'm also, as you heard, the chair or the content chair of this conference. So if you're having a wonderful time and learning many things, you can thank me, or if you think we missed the mark, you can also blame me. But it's been truly an honor. So I'm here to kind of take up from where Laura Lee left off and talk about how the state and the federal government are interacting in certain ways, and then talk a bit about what's going on with FDA, if one can sum that up in any reasonable way right now. But my first slide is specifically about the state of California. For those in the audience who don't know, California has enacted a full flavor ban on all categories of tobacco products. And this year there's legislation going into effect, and many of my clients, some in this room, some not, are racing towards a deadline of this Thursday to complete their product registries in California to be on the unflavored tobacco list, and therefore able to sell post January 1st in California. But the important thing here, and I know this is a little small, these are all questions about your FDA filings for every product you want to list in California. And so I think, following on what Laura Lee was saying, the United States is, I always say, the FDA is the barrier to entry, the states are the barrier to the shelf. And that the two are combining in ways that they were never meant to. The states are not allowed to enforce FDA law, but they're continually, between both the registry bills and now what we're seeing here with California, coming together on this to almost try to. And it's sort of an alarming trend. We know that the state of California, the Attorney General's office, is talking to the FDA and vice versa. It makes it very uncertain. We already have the uncertainty at the federal level. To now be bringing it into the states is something for everyone to remember when talking about the US market. But moving on from that, we go to what I call the current regulatory landscape. And these are just some of the words that we are hearing currently, right? And I'm the first to admit, I've been doing tobacco product regulation in the FDA marketplace since the day the Tobacco Control Act was even thought of. We needed disruption in this category. We needed disruption at the Center for Tobacco Products. Is this disruption that we're seeing today the right disruption? I think only time will tell. But these are some of the words we're hearing, right? We're hearing things about expedited pathways. We're hearing things about transparency, common sense, gold standard science, right? But then we also look at things like our basic tenets in the space, appropriate for the protection of public health. What does that mean? Why does it keep changing? Should it keep changing? As someone who still works in the traditional combustible tobacco space as well as the new product space, different question of public health, which is what we look at for combustibles, and part of the conversation that isn't happening as much anymore, but is still important to this group, right? We can't move away from something until we understand where its role continues to be. We talk about enforcement discretion, enforcement priorities. What does this mean? Whose discretion, whose priority, and what is enforcement today? The burgeoning illicit market, where does that play, right? Are standards changing? Are they refining? All of this is up for grabs right now. It is a new era. I think some of us would say very, very much needed. But I think, to my view, the question is still out of, is this going to be the disruption we need, or is it simply disruption for disruption's sake? So I'm very much looking forward to the conversation with this group of colleagues, because I think we are probably some of the most educated in the room on it, and also just the different views. And I think even from our last prep session, we probably have different views today, even as things evolve. So with that, I will turn it to Jessica.
All right, thank you, Beth. Okay, while we're getting that up there, hello. My name is Dr. Jessica Zadinak, and I'm owner and Chief Research Officer of ARAC, Applied Research Analysis Company. And I'm gonna flip the switch a little bit here today and talk more focused on the consumer in the United States and their perspective and what they're looking for, what they're needing, and the really, really big disconnect between that and the marketplace, regulatory landscape, and environment. I guess there we go. So first, thinking about in the United States, the person who's, I'm sorry if this is acting up, the person who smokes, they are not us. And that is one of the most important things that hopefully after this presentation you can walk away knowing. So this is the statistics you see. The data on the right-hand side comes out as an aggregate from a lot of our work that we do with consumers, whether or not it's simply product development, innovation, or to support PMTAs. And okay, so 65% of them are making between $10,000 and $75,000 a year. And I would say, 30 or 40% of them are, and this is their household income, and they are married. 5% of them are making less than $10,000 a year. Our data shows, and the smokers that we get for our studies, it skews to those that are over 35, so roughly 70% of them, 25% of them being 25 to 34 years of age, 25% of them having bachelor's degree or greater. That means 75% of them do not have a bachelor's degree. Really, it's half and half. 50% of them have tried to quit smoking. Is that right? Is this okay? All right. And so really the take-home message here is they aren't us. So how is it that we are sitting in a room, sitting in a room and talking about the products that we believe are best for them and the policies and the regulations that are best for them when they aren't the people, when they aren't us. It has a lot to do also when you're making policy, right? To have in the US the congressmen and women who are making laws and they aren't considering the people that they're governing. So the other main thing on this slide is to show the significant decline in adults who smoke in the United States and youth. Hopefully you're able to see that, as well as sharing some quotes along the way with my slides here. The last one, very much similar to the data I'm sharing, which is, these are exact quotes from participants, from smokers in the United States. You won't buy food because you need a pack of cigarettes. These are crazy things. That is the life they are leading. And so let's talk a little bit more then about what their needs are, what their wants are, and what are they getting from the US regulatory environment and industry. And so we study every single category, product category that you can imagine, from, again, beginning to develop those products all the way through to getting them onto the market in the PMTA. If your product is touching a consumer, we are doing that type of research. So again, these quotes are pulled directly from them. So again, we're sitting here talking about risk perceptions. We're sitting here talking about warnings and types of nicotine. What they're talking about is on this pouch can, it says don't put it in, oh my gosh, this is really annoying, I'm sorry, but it's just more annoying that it keeps going in and out. But here's a quote, how are you supposed to put this in your mouth if you're telling me not to get it on the skin of my hands? Zero tobacco nicotine means no nicotine. Nicotine came from tobacco. And if this causes cancer, you might as well smoke a cigarette. And those 3 quotes were specifically from nicotine pouch products. So one of the big issues right now in the United States is the disconnect between the U.S. consumer, specifically the smoker, and what their perceptions of risk are. The data you see on the right is pulled from one of our studies, our tobacco product perceptions and intention studies. And as you can see, their risk perceptions of nicotine pouch products is around 62. That of 10 cigarettes daily and nicotine pouches is 72. That's a 10-degree difference there. And combustible cigarettes, the difference even reduces down to 8. So again, there's a huge disconnect. So what is motivating smokers to transition away from the most deadly product if they believe that the risk there isn't really that big of a differential? The quote there at the bottom, I had a doctor tell me the same thing, blah, blah, blah. Now, well, if you quit smoking, it might go away, talking about an abscess. But no, he does not support it. Talking about nicotine pouches. This one smoker asked their doctor about nicotine pouches and the use of them, and the doctor said he doesn't support it. And so the person said, what would you rather me do? Do that or smoke regular cigarettes? And the doctor said, well, it's all got nicotine. I'm like, what if I go to vaping? Just to see what he said. That ain't good either. So there's also a huge disconnect between our healthcare providers in the United States and their education and what they are communicating to their patients and what is actually true. And so we're also focused in on correcting that misperception, because when you ask smokers who do they trust, they do not trust industry. They actually don't trust the federal government, but they trust their nurse and they trust their physician. And so until we correct that, I think there is little hope for more global change and U.S. change. My last slide here. So the data on the right hand is, I basically went online and aggregated nationally representative survey data. Because in my head, what I am thinking, right now in the United States, we had a pilot program by FDA just got launched, and there are 4 companies that are within that pilot program specific to oral nicotine pouches. And they're talking about fast-tracking those applications and the potential for, kind of changing, quote, standards and requirements for getting those products authorized. My biggest concern, and being in the industry now 11 years, is get ready for another Wild West from the end space. So that's a question that is constantly zooming in my head. But also, was FDA wrong in their concern with the youth using ENDS products in the United States? And if you look at the data, I would say no. So the green line is going to be high school users' current use of ENDS products. And by the way, I was also a statistician, and I know that data, you can make it say whatever you want it to say, but I pulled this from the primary, nationally representative sample. And it's obvious, like the green line is the highest across the board. We have 36 million smokers in the United States today. So where is the opportunity here? It's with the smokers. So that would be the navy blue line, ends adults. Still, it's going up, right? But it's still certainly not as high as the high schoolers or the middle schoolers, which is then in the orange line. But you do see that coming down, right? Drastically coming down. But what do you see with the adults? Going up quite a bit. Now let's compare that to the nicotine pouch space. And the light blue line is pouch use prevalence of adults, pretty stagnant. And then you have the orange, the purple that is showing the youth use of pouches. So here we are now in a regulatory environment with smokers telling you, as you can see on the left-hand side, it's too much nicotine, it's too fast, I'm gonna throw up. It took a couple months. Most smokers take at least 2 weeks. Most of them take 1 month to 2 months to transition from smoking a combustible cigarette to an oral nicotine pouch product. But wait a minute, we're dealing with people who don't even have money to sometimes buy food. they do not have the expendable income to go and do this trial and error that is required to have them switch. Luckily, we get research studies that are doing that, and we're saving lives. Now, is there room for pouches in the U.S. market? Absolutely, absolutely. I still think there is major untapped potential. But when we look at this, where is the opportunity for public health to improve? Where is the opportunity to save lives? And it is within the ends specific space, specifically with flavors. I will go to my grave saying that variety and flavor choice drives switching and drives public health. But instead, CTP has come out with a pilot program focused on nicotine pouches. And personally, that's not the big bang for the buck. So there is a huge disconnect currently between what we're seeing in the market with consumers and then what FDA is doing and implementing. So with that, I will pass it to Valerie.
Thank you. I didn't get the memo on the slides, so I'm just going to talk at you for a few minutes, if you don't mind. Hoping we can spur some conversation later that, if nothing else, will eat up the remaining 30 minutes. But, I just got back from a national assignment. Let me back up. Valerie Solomon just started a new function within Reynolds American called Scientific and Public Health Affairs. And I was previously at BAT for 3 years doing an international assignment in the legal space after having served 12 years at Reynolds as the head of legal regulatory. So all that to say, I have a perspective on FDA. I've discovered it's pretty dusty. Some things have changed quite a bit. A lot has not changed, unfortunately, or certainly not for the better. I think the past 3 years I spent a fair amount of time actually working in the dietary supplement space, getting a sense of the regulatory schemes in various foreign countries, Canada, Australia, the UK. It was very interesting for me to see that these products that even more people than tobacco touch, folks don't necessarily have a lot of information about them, and there's not a whole lot of regulatory restriction with respect to what they contain or their quality, or certainly not relative to the way that tobacco products are regulated. So coming back here, I sort of secretly hoped that everything had gotten much better in my absence in those 3 years. One of my last big acts before I did go was to finish filing the last of our PMTAs on a whole panoply of new category products. So some of those are still languishing. I was pleased from afar to learn that the Alta product had gotten an MGO. I have been gratified to see that other products in this space have also gotten MGOs, because I think ultimately, if nothing else, it provides an opportunity. What is it? Rising tide raises all ships. That's not the party line, I'm sure, but ultimately, it's, the more we have in terms of harm reduction products, the better. But I think what's been most disappointing to me ultimately is the fact that, in addition to the fact that these products are not moving along, and I think a lot of folks sort of held their breath at the election last year and thought there might be some major movement from an administration perspective, is that even the bright spots that you're seeing, like the NGOs, like Secretary Kennedy's statement with respect to the harm reduction potential of nicotine pouches, they've all been sort of muddied by other statements, hyperinflating the amount of youth vaping or calling things an epidemic that aren't actually an epidemic. I think the inconsistency of that narrative is really troubling. Not shocking, but troubling. I think ultimately there's just really a lot of opportunity despite the signs of progress. FDA actually was speaking to Laura Lee before the panel, and I'm stealing your idea, which is essentially that FDA could take advantage of not focusing so much on trying to beat combustibles in the ground, such as with the very low nicotine rule, and focus more on actually trying to authorize and provide a more, more clarity around the pathway for products. I think it wouldn't hurt to have a definition appropriate for the protection of public health. I do, to your point, recognize that would have to change from time to time based upon whatever data was available. But to harp on the administration once more, the data that previously was available is now currently not available. So we're all sort of scrambling to figure out what are the best signals in terms of youth uptake of pouches, or whether smoking has sort of bottomed out, or if we're still looking at a steady decline. Again, lots of opportunity. Ultimately, I think FDA has the most important responsibility as a public health agency to clarify these issues, to provide risk communication to consumers in a way that's actually palatable, that's approachable, frankly. I mean, reading the quotes that you have from the folks that have read your surveys, it's very clear that they don't get it. And I think BAT this morning announced some research across 15 countries showing that while more than half of healthcare providers speak to their smoking patients about harm reduction, only 20% of them feel like they know enough about it to even talk about it intelligently, which is really troubling. And I think one of you mentioned as well that the industry is not the best bearer of the harm reduction message and that we're not trusted. I think there's actually increasing distrust in terms of healthcare providers, but we all have to start somewhere. I'm a little troubled by the MAHA movement. I think just the death of expertise over the past 15 years and folks generally disdaining to believe that someone who studied in this field for 30 years doesn't know what they're talking about. That's a problem. And yet, as the Stanford educated doctor that was in this stage earlier this morning noted, even though he believes in it, there's not enough of a groundswell in that space and not enough providers that are actually speaking in a meaningful way, like Dr. Beaumont. Ultimately, I mean, I think from my perspective, I've only been on the role now for 3 months, I guess July. So there's a lot of opportunity for me to help the scientists within Reynolds amplify their science, because we do a lot of really great product science. I think we have all of these companies, and we all have really great people working for us in the science space, but the fact is we have to do certain product science to be able to get a PMTA support. So it's out there, and I would argue too, seeing some of the ridiculous things that come through on our daily digest, that we are doing far better science than most people in this space. But ultimately, again, we're not to be trusted. So my job is to help amplify this information to people who will be trusted, whether that's healthcare providers or academics or, where's Jazz? Shout out to Jazz. Folks who will listen to us despite any institutional barriers to their actually cooperating with the industry, which I completely understand. But I will say as well that with all the things happening with the administration, I am hearing inklings from folks who wouldn't have taken my call 6 months ago, who are now curious about working together. And it's an intriguing possibility, a little frustrating, because we were also intrigued to work together 10 years ago when they pulled ties with us, So Florian over here is probably worrying about what I'm saying right now, but long story short, I think my job now is to support not only the submissions team and help them amplify the science that FDA will be reviewing, but also help my Lex colleagues, folks like Beth, who need that science to be able to advocate for the industry, or even just for common sense regulation and rational policy. And science will lead the way if we get out of their way and just let it speak for itself. Thank you.
Terrific. So you guys each hit on some themes that I'd like to kind of pull through a little bit. So Beth, you talked a little bit about chaos and disruption, and I think one of the first signs that we've seen of a disruptive approach is this expedited pathway announcement, right? For those who haven't sort of been paying close attention to the US, what FDA has said is that they intend to bring some certain pouch products, working with some certain manufacturers, through a short review, and then they're going to kind of dial into certain aspects of the application. That's kind of what we know. So I'm curious if anyone has a point of view, and certainly Beth. How does this kind of line up with what we're hearing from Dr. McCary about common sense, about gold standard science, any point of view on this disruption?
So I'll say this, and picking up on something that Valerie said that I think is so critical here. The MAHA movement is interesting, right? And Jazz and I were having a very interesting conversation. Jazz, we're going to continue to pick on you because you're just so wonderful. But no one, I think, is against the idea of make Americans healthy. I mean, that's a good premise, right? And I think that part of the idea of disruption is that you are a change maker. Disruption can be good, disruption can be bad. There are many disruptive companies in this room who are doing disruption for good. So the pilot program that FDA has announced for pouches, I think there's some real benefits there. We need a faster pathway. We need something. Part of what they've also said is it's going to be a more interactive process between the applicant and the agency, something we have been desperate for the past, since 2009.
15 years.
Yeah, desperate. I mean, the amount of times I've had to counsel a client to say, understand we're going to go meet with the agency, but that means they will sit there silently and stoically and just listen to you and then say, thank you very much for coming in. And they go, but it's a meeting. And I'm like, yes, well, but no. And even slightly seeing changes now where we've had a couple questions, right? So this idea of an interactive pathway I think is fantastic. My concern is that, to Jessica's point about e-cigarettes, a year ago, we were hearing that there might be an expedited pathway for age-gating technology or other technologies that could help allow flavors to be available for adult smokers. So while I'm encouraged by new and intriguing ways of FDA looking at expediting review, do I think it's the answer? I think it can be part of the answer. I think the largest thing, to my perspective, and this goes back to the entire tobacco and nicotine space, FDA's main remit is to be a product regulator. That means products are to be on the market, they are to be authorized, they are to be reviewed, and they are to be done so in a way that accommodates the business. It is not to be just a block to everything.
Gatekeeper.
And I think when we talk about the science and how important that is, it's also, are you creating good products, whether they are cigarettes, whether they are pouches, whether they are vapor products? How is the consumer to know? Because they won't authorize products. They will continue to authorize cigarettes, but they will not authorize more than the 39 e-cigarettes and the 20 pouches. That essentially is about 7 products combined.
Well, even with those authorizations, though, I don't think the FDA has done a sufficient job of explaining what it means to have an authorization.
Nope.
Right? Like, your average consumer is not going to know what appropriate for the protection of public health is. I mean, hell, I barely understand it. And, you know, the best definition that we get for it really comes out of the market granted orders that have been issued. So it's like one product at a time. We're sort of uncovering what this special term means.
And I think that's where the new pathway does have some benefit, right? We've had Secretary Kennedy stand up and say, as a basic principle, these products should be good. Like, they should, but each one is going to depend on its own individual product science. And I think that's a move forward. But to your point, I also don't think consumers, or even half the people we talk to, understand the difference between authorization of tobacco products and approval.
Yes.
of
No,
drug
they
products.
they don't even, that is not even within their repertoire. They literally think if they can go to the store and buy it and take it home, the product's on the market, right? I mean, there is
Somebody allowed it.
nothing
Yeah.
beyond it, right?
Yes.
There is someone allowing it, and that's okay. You know, the big concern is when we look at the nicotine pouch space, and consumers look at the labeling and the packaging, and they see things that they do not see as far as warnings and instructions. They don't see that on their cigarette box. I mean, we've had people not try nicotine pouches who are 2-pack-a-day smokers because they see keep away from children, pets, digest and things that do not digest, and they think it's 10 times more harmful. But yeah, there has to be some type of very straightforward communication to the consumer. But they are going to assume if they can bring it home and use it, someone's allowed it to be there.
Yeah, I think, sorry if I
Go
can
ahead.
swing in, I think part of what they're hearing, or what a lot of our consumers are hearing, is essentially whatever's sensationalized. So they hear about volatile, which we all know was not really a thing. I mean, it was a thing, but it was not a tobacco-related thing. They hear about this youth epidemic of vaping, and if you look at the figures, it's indeed not at an epidemic phase. I mean, I totally understand the importance of underage use prevention, absolutely. But I think the sensationalized aspects, those are the things that get picked up by the news. Those are what the average consumer will hear. Even when the news is good. I mean, I have a family member, who shall go unnamed, who is a religious user of Copenhagen. My apologies to Reynolds. And he had no idea.
Thank you very much.
He had no idea you guys had a modified risk claim. No idea. He's like, there's literally decades of epidemiological evidence on this product, and he just kind of got glassy-eyed and no idea, where's my Coke, basically.
Yep.
And it's just such a missed opportunity. I think I'm old enough to remember when FDA, very early days, did a 2 or 3 day risk communication tip-stop with the risk communication advisory committee, and they came away with absolutely 0 recommendations other than, gosh, it's super hard. And in the interim, they essentially over-indexed on trying to scare people, scare children, worry about children, and there hasn't been any additional effort to tease apart the fact that while maybe there's data showing that scaring children away is a good thing, you're also scaring the hell out of the adults, especially the 40 to 60 who could really benefit from quitting smoking right now with something.
Well, those children will become adults. And so we've just got like another generation of kids that are confused as a result of that effort.
And something I find so interesting, picking on that point, obviously many of my friends know what I do for a living, right? And they said, do you know the only thing I know as an adult about vaping products I've learned from what my kids are being taught in school. And she's like, and what they're being taught, she came home to me with like the booklet and was like, this can't be right. And I was like, well, it's not. I was like, it's just not. I was like, and you know, it was fascinating to me that not only to your point are we, and then those kids are gonna work with those misperceptions.
So information has been a theme this morning so far. Let's just go there for another second. One of the things we're seeing out of this administration is an increased focus on illicit products and enforcement. That seems to be an area of focus that we've seen some attention. I'm curious, Jessica, particularly from your angle, what do consumers observe there when they're seeing headlines about seizures and such? How are they internalizing that?
Yeah, I would say most of them, or at least, I don't know if I could quantify it, 50 to 60% of them are not even paying attention to the headlines. And we have to remember these are individuals who get to research studies by bus, public transportation. They do not have vehicles. Some of them don't have cell phones, and so it's a huge disconnect between us getting up in the morning and looking at our cell phone and looking at headlines and news and being so ingrained in it. To them, it is a product that gives them nicotine to get them through the day, and some of them, this is the only thing I look forward to. So it's a very different mentality of what the utility of the product is for the majority of the consumers. Those that do recognize it, once again, they're and I'm not saying this. I want to make sure I don't interpret, have someone walk away that I'm saying this in a negative light for consumers. I'm just trying to paint a picture of what the majority of the U.S. smoker, and being a former smoker, but they have struggles that some of us have had, but not when it comes to 3 and 4 of them all together and multiplicative, and they are wondering about their food for their kids.
Right.
Yeah.
So I have lots more questions, but let me just pause and see if there are particular directions you want this panel to go. Any questions?
Don't be shy.
Yeah. Okay, well, jump up if you do.
We got one. It's your colleague. We got one.
Muhammad.
Oh, I'm sorry. Dr. Sarkar, please.
Well, first of all, it's such a joy to see such talented women on the panel and great insights. So as we talk about this U.S. regulatory landscape, and somebody mentioned about the focus on youth, and overall, if you think about ABPH, it's about balancing the youth versus adult switching. Do we think that the people who are involved in looking at the applications understand the fact that it's not just all about kids, and trying to strike that balance to take into consideration the vast majority of adults who need and are seeking for alternatives?
Great question. Anyone else?
I'll jump in first. I think, Mohammed, it's you can't speak about an FDA reviewer as a monolith, right? Because there are many different people, and we all know many of them. I think that there are reviewers who very much are focused on the adult smoker, and that we need to look at these products through a holistic lens. I think there are also reviewers who probably bend as though nicotine and tobacco are just a scourge, and they want to find every reason to not authorize products or continue to allow products. And then you have the people above them who are making policy decisions. And I think all of that has become more challenging, and I think the space is becoming more politicized. And so even if you have people who are understanding the balance, and the Tobacco Control Act is supposed to be equal between those things without just a weight on youth, the outsourced rhetoric, the over rhetoric about youth, I think is putting that weight on it in a way that is just not helpful to the idea of that this is supposed to be an adult consumer marketplace. The youth are just one part of that to make sure that they're not being targeted.
I think it also, the single biggest predictor of a child becoming a tobacco user is having a parent in the home
Yes.
who is using tobacco. And so I think that gets lost sometimes, right? This idea that you actually do help the kids by helping their parents find a better outcome for themselves. So I wish that would be more top of mind for people who are making these decisions.
And if I can expand upon that, I love that you made that point, Larly, because I've been a big conversation starter of it's almost the parents' responsibility to make sure the education is being filtered down to their kids
It is.
a little bit. And however, my oldest child's 11, and one of her best friends has vapes in her bedside table, and yes, because her dad vapes, and it was offered. And so here I am, having a conversation about vapes with my 11-year-old, and so it is a problem. But is it a problem because of industry or manufacturers? No, it's a problem because parents either, to be honest, aren't concealing them and keeping them away, and maybe that's why CTV then said, hey, let's age gate, right? But
And it's just, I'm sorry, briefly, it's not easy. I think I know more than the average bear about harm reduction, both scientifically and legally, and yet when my son started private school in the UK and was bringing home all kinds of crazy things I'd never seen before, it was, would I prefer that he not touch tobacco at this age? Yeah, absolutely. Am I glad that he picked up a vape and a pouch and not a cigarette? Yeah, absolutely. It's just, even though I have more information, it's still not easy to have that conversation, but it has to happen.
Excellent. We have a question here.
Yes, thank you very much for the talk. I have one question from the European perspective. If we look at the authorization of nicotine pouch products in the US and look at the official statements, conclusions, where it is acknowledged that these products are much less harmful, I think is there not hope that the US authorities are a little bit more constructive and may also on the global stage contribute to increase the trust and acceptance of new products?
So, if I'm understanding the question, should the authorization system increase trust in those products? Is that what you're saying?
I ask whether these are a good example, the authorization system in the US, especially in contrast to the approach of the European Commission.
I'm not sure I'm following the question.
I think if I'm following the question, the authorization system in the US has potential, but I would not say it should be a model from my perspective.
Yes,
Is that what you're asking?
well, there are many good aspects and also
There are
in the
many-
outcome in the statements, and if you compare to the communication of the European Commission, I think it's far much better. And that's why I think it really could be, to some extent, an example. On the other hand, it's very complicated.
It could be. It's not so much even how complicated it is. I think to a certain, from the perspective of putting together a quality application, I think at this point, not to speak for the rest of the panel, we could all say to you, or I could say to a client, I can advise you on what you should be putting in your application based on the Tobacco Control Act and part of what we agree with in the regulations, right? The complication comes that the implementation keeps changing. So what I would say is that part of it is the US legal system and that it is just different and we have different legal constraints or boundaries. The authorization system isn't bad. The way it's being implemented is. So I caution for the EU Commission, I would caution of how do you take out that subjectivity and make it objective on the science of the product.
Yeah, there's still, I think, a fair amount of politics that gets in the mix when it comes to these authorizations. So while I do think there are very good reviewers, very well-trained scientists at the FDA who do care a great deal, there's another layer of administrative politics that sits on top of that. I mean, if you look at just the ZYN authorization timeline, which is there in that TPL, the agency set on a decision for 2 years. Now, I can speculate as to why that might be. It certainly took 2 rounds of NYTS data coming out before they finally issued that decision. But that shouldn't come into play, but it so often does. And I think that is a real barrier to it being a much more effective system than it is today.
I think many of us believe that kind of the bones that Congress gave FDA are in the right zone, right? Can clearly direct a regulator how they might bring the right kinds of products to consumers. It's the implementation that I think has fallen far short.
But have we even been functioning within the PMTA framework yet? And I think I said this last year at the GTNF panel. We are still playing catch up from all of the products that have been on the market or flooded the market. And my concern is we're getting ready to see that again with nicotine pouches, whether or not they're applications that are just, they don't have good science in them, or people bringing products to market without even applications and having the illicit market be flooded. But the pre-market tobacco product application is for products pre-market, before they're on the market, and we aren't even there yet. I think we are getting there with pouches, but
Maybe.
Well, I think we learned a lot from what has happened with e-cigarettes, right? The FDA comes into an existing marketplace of products that consumers are using a lot of, and they say, you don't get to have these products anymore, and they ban flavors in the pod systems. And you had a bunch of consumers who were accustomed to having those options. So they turned to a black market to find the things that they were not getting. So I'm also worried that unless we see a lot more authorizations, a lot more products get authorized, you're gonna see the same thing happen with nicotine pouches that we saw with e-cigarettes.
So what, sorry, was there a question?
After all that waiting, you're gonna give it up.
Sorry, I can't see.
No,
Go ahead.
I just wanted to have a follow-up question and would like the panel's perspective. So given the intense focus on youth initiation, particularly in the vapor category, do you folks believe that FDA would get comfortable enough to authorize products with the follow-up intent of post-market surveillance? And can post-market surveillance play a role in allaying some of the fears that FDA has of, oh my God, the horses could leave the barn?
I was going to say, that's the way the statute's supposed to work. Yes, Mohammed. But I'll just let my colleagues go on to that.
So, first of all, post-market surveillance has a great place in the entire framework. But my big concern, and I would love y'all's perspective too, is so the product gets authorized and CTP says, all right, we're going to rely on post-market surveillance to track youth initiation, who's using the products, what are the demographics, and skyrocketed youth use. And when I say skyrocketed, whatever level they consider to be skyrocketed, right? So first of all, I almost think industry should be careful if we go in that direction, because now where is the objectivity of what is, too much risk, too much negative youth use? So where's that coming from? But now that happens, the product's already authorized, it's already in the market, it's already in consumers. How do products then get removed from the market quickly? But also, if CTP can't even communicate to industry frequently or at all, how is there going to be a communication and a time frame for which the industry says, hey, we've got real-time data collection of the initiation, who's using our products, here you go CTP, and how long is it going to take CTP to review it, respond? And I could honestly see a severe, product coming to the market with severe risk, and youth are starting to use it, and by the time CTP responds and the product's removed from the market, it's done. You've already got your problem. That would be my big concern.
I also think the concern is that, again, this goes to the distrust of industry, and I'm gonna go to my dear friend Laura Lee. Like, her company collects amazing data on youth usage of all usage of these products, and it's not youth, right? Because they're not selling to youth. In the same respect, there are many companies in this room who are doing data tracking because we're not certain the government will continue to do it. There are also many technology solutions out there that are coming to bear that can track who is using the products, when they're using them, how much they're using them, are they being used by the right people? I actually think that post-market surveillance, where FDA to be a little bit more forward-thinking and partner with some of the amazing groups that are out there and say to industry, be our partner in this so you stay on the market, the statute absolutely contemplates it. Much more so than the restrictions they put on authorizations, but they have to be willing to accept that data and partner with the people collecting it. And so far, that's just never.
We're short on time. I want to get Lillian's question. Go ahead.
Good afternoon. It's a wonderful panel. Great discussion. I enjoy you ladies as friends, but as panelists, superb. My question is, I think you touched on it, and Jessica touched on it as well. What are your thoughts on the administration and the FDA leadership picking nicotine pouches and selecting it for an expedited review process when the problem really lies with the entire process and picking one product category over the other, where it should be creating the process or fixing, redesigning the process so it's effective for all? Because it is kind of sending a message to consumers that there's one product that is better than the other, or that we feel is better than the other, kind of making the choice for it. So I just kind of wanted to get your thoughts on
That's
that.
a great question, and certainly the bulk of the applications still exist in the ends category, so it's a tiny solution, but please.
There were comments to the guidance ever so long ago. There was one comment the FDA answered around an expedited pathway for these products. So to a certain extent, they're kind of picking up on an earlier idea and seeing it through, which again, we all love to see. I think the bigger problem is that it's an easier place for the agency to go. It's a much simpler product. However, when you look at other categories and how many people are using other categories, arguably we're not attacking this from a standpoint that gets at the majority of the folks that are using harm-reduced products right now.
I'm gonna bring up a slightly cynical point of view, which for those of you who know me is shocking. But it's an easy give, right? They've created this rhetoric and narrative around e-cigarettes that is frankly so incorrect. For them to be able to walk that back is very difficult. And even I think in the age gating area where they have also made certain promises of expedited reviews, still not think they're certain of how to do that. The pouches are sort of universally seen as should be a no-brainer. If you make a well-constructed, good product that you can manufacture to scale, you do the things the statute requires, and I think they just feel more comfortable there. The fact that the Secretary has made his public statements doesn't hurt.
Yeah, and being in the federal government for 4 years, I personally think that they are sitting there saying, you guys both said it, easy win, but they're also saying in leadership, I am not touching the end space with a 10-foot pole. I am not going to be the one that authorizes a flavored ends product, and so it's just going to sit there. But also thinking about, the use of nicotine pouch products, my big concern is, does CTP know what we know, that it takes a while for a cigarette smoker to start transitioning to a nicotine pouch? I think they see it, like y'all said, an easy win. There's not going to be a huge uptick in prevalence, perhaps not, and so it's just an easy win for them. And what this has now done, though, to our clients globally is, you should see the floodgates have opened, and we're sitting here going, there's 4 companies identified in this pilot program, and they're going to assess this as a means to getting a nicotine pouch product authorized. First of all, do we really think it's going to be done by December? And then second of all, do we really think then they're going to take that implementation of the program and the standards in which they authorize the products and apply that to all nicotine pouch products? Because there is an archetype here that is within the applications to be reviewed. But I think they're just basically saying, doing this, raising, their green flag, look at us, we're doing something now, and I think it might be kind of a show.
Yeah, I think all in all, it's a promising development. I love the fact that the press release mentioned the continuum of risk, and I literally wrote it down so I'm not running into any, potentially reduced risk products. So ultimately, I think that's great. But I think the fact that FDA has not clearly articulated what that continuum of risk looks like to them. You'll find it on their website if you poke around a little bit. They've got some statements about it. But it has to be all the money and effort they put into the crazy heavy metal ads or nicotine body worms. If they would put that into, hey, parents of children, check this out. This is what you need to know. Have this difficult conversation with your kid. It's a huge missed opportunity. I know that I'm totally pivoted off what your actual ask was, but love it. Nicotine pouches definitely as close to end-risk as you can get on the risk continuum, but who the hell that's not in this room actually knows what that is at this point.
So with the short time we have left, I'm looking for kind of the one solution that any of you think should be kind of acted on at this stage of the game.
I'll resist the urge to say burn it all down. I would just say,
Well, I think
I think that's been my common theme over the past several years now, right? I'm a born and bred FDA lawyer, so I respect the laws, I respect the regulations, but if I had to focus on one thing, I would say just redoing their communications, because it has so much impact. It'll help the youth,
Wondering if someone would go there.
I mean, I have my 2 best friends came to visit me in the UK, and I'm vaping, and they're like, I thought you quit smoking. And I'm like, do you not really know what this is? And then I had to launch into the entire, I'm sure they were sick of the whole conversation by the end, but it's if my friends, if college-educated people, if parents of children don't know what these things are, then how do we get anywhere?
Anyone else?
I would say go back to the statute. That to your point, is it perfect? No. is it a better framework than the way that they have interpreted it and twisted it and lost the goal of what the purpose was and manipulated it? I mean, there's a constant talk about manipulation of the industry, like the industry manipulation of FDA, but FDA is manipulating the industry at this point, and the consumers who are actually dependent on attempting to figure all this out. If we went back to the statute and just regulated the products, might be a start.
Open dialogue.
Yep. Excellent.
All right, on that happy note, good communication, open dialogue, and go back to what the statute intended. Thank you to the panel. Thank you, everybody.
Thank you very much. Thank you, Paige. Thank you, Beth. Thank you, Lauralee. Thank you, Valerie. Thank you, Jessica. And a special thank you to Jessica and the fantastic team at ARAC for being our opening lunch sponsor. Lunch will be happening now. As I explained, it's